There are various treatment options in regard to the management of obstructive sleep apnea. They are broadly divided into devices, which include non-invasive pumps such as CPAP or APAP. We also use mandibular advancement devices that move the jaw forwards, and they are divided into temporary devices and professional devices. Thirdly, there are devices that actually move the position of the tongue, and the best example is the Avio tongue suction device. We also have nasal EPAP devices that treat snoring by splinting open the airway. Positional therapies keep patients off their backs if there is mostly a strong supine component of sleep apnea. And then lastly, there is also surgical options. Of the various temporary devices, the SleepPro Contour remains one of my favorite. The reasons include it is easily adjustable. However, patients still have to have enough dentition for this device to work. There's 7 different settings. And it also comes currently with a 50% refund if you're not satisfied with the product in 30 days. The ballpark figure cost is about 150 Australian dollars. There are various professional devices, of which the 2 most common ones are either the Uventus and also the SomnoMed devices. The purpose of oral appliances is to move the lower jaw forward, which results in the forward movement of the tongue and opening up the soft palate. This reduces sleep apnea more effectively in patients with body mass indexes of less than 30, those with an overbite, those with mild to moderate apnea, and is dependent on the skill of the dental practitioner. Tongue suction devices are best used in patients who are edentulous. For a mandibular advancement device to be effective, the patient needs at least 10 teeth. The Avio TSD gets around this by simply creating a suction that pulls the tongue forwards and pulls the soft palate out of the airway. The drawback of mandibular advancement devices are that they are expensive, they cannot be rented, and can also have a significant impact on your bite, as well as temporomandibular joint. Some dental practitioners do offer quite a significant rebate on these devices. The other therapy that is very frequently used for the treatment of various severities of sleep apnea is CPAP or APAP. CPAP creates a positive pressure between the upper airway and the vocal cords, which splints open the airway and move the soft tissue. This then allows the patient to have an open airway, normalization of oxygenation, and absence of snoring. The newer generation devices are APAP devices, which mean they change their pressure depending on position. They tend to escalate therapy when supine, and the pressure is lower when in the lateral position. Theravent is mostly used for patients with very mild obstructive sleep apnea, more along the upper airway resistance pathway. This works by creating a pressure through a one-way valve that goes underneath the nose and splits open the airway and reduces snoring significantly. Lateral positional devices such as the night shift device keeps you off your back, and by keeping you on your side, reduces the severity of obstructive sleep apnea in those patients where the vast majority of apnea is supine. They also have the benefit of being able to track data, so there is a download of all the information provided. The scope of this talk does not include surgery, which is covered rather by Mr. Nalaka de Silva.